I want to start with some questions a question that was submitted to me that I thought was really interesting beforehand. I have my first appointment with a doctor, a phone appointment tomorrow, and I'm going to be tested for ADHD. Okay. I've been on different medications for depression, anxiety for well over a decade now. Nothing has worked, and the more research I've done, I really do believe that the anxiety I've developed has been due to undiagnosed ADHD. I'm so dreadfully low at the moment and feeling incredibly lost. This is from Emma. So, Emma, if you're watching, I'm so sorry to hear this. Um, uh, I'm scared about being dismissed and being told it's the depression, which, like I said, I know I have it, so it's a product of not being diagnosed. I'm rambling. Does anyone have advice on how I can ensure I'm taken seriously? I have an idea that maybe if I could write my symptoms down in advance and read them over the phone. So, Emma, I think that's a great idea. I think it's also important to go in with some statistics. So, in terms of diagnosis, 34%, a third of people with ADHD also have been diagnosed with anxiety. We clinicians think that statistic is actually low and that there's more occurrences of anxiety in real life but people may not have received the diagnosis or met the full qualifications for the disorder, even if they're close to it. Untreated anxiety leads to depression, and the rates for depression among people with ADHD vary between 16 and 30%. So I think you're on the right track. Also, women tend to be referred for ADHD treatment, but not directly. They tend to say they seek treatment for anxiety or depression, and that's what is taken sort of more seriously, and the ADHD part is seen as a byproduct. So I think it's important for you to go in armed with some knowledge about women in ADHD, what the statistics are, and what your particular symptoms are. That makes a lot of sense. Let me go over to some questions. Hi, Violetta from Greece, or from Den Haag, which I'm not sure where that is, but thank you for joining. So Charissa says, I'm very interested in common comorbid symptoms between ADHD and anxiety. 8-year-old son has been diagnosed with ADHD for about 4 years, but really struggling getting back in the groove at school. So as I said, ADHD and anxiety travel together a lot. You know, 30 a third of a third of people with ADHD have the diagnosis. We can assume that more people have anxiety but haven't actually met the criteria for the diagnosis, either because they haven't sought that or it's just been subsumed under the ADHD. Getting treatment for ADHD and anxiety is very important. Certainly, treating the ADHD can lower the symptoms of anxiety because some of the anxiety may come from when am I going to mess up that I didn't know that I was going to? When am I going to miss something and have to catch up or deal with the shame or embarrassment that I wasn't that I wasn't as present or aware as I would have liked to have been. What am I going to do wrong? Okay, what am I get negative feedback publicly so people know. And then there's just anxiety. There's just higher rates of agitation. And so I think it's really important when your child has anxiety and ADHD or you have anxiety and ADHD to zoom out a bit. Reassurance, telling kids that things will be okay, often may work in the short run, but it doesn't teach lasting skills in the long run. And we know that challenges with working memory can affect kids with ADHD and adults with ADHD as well, because working memory is the seat of that how we that place in the brain where we hold things and we decide what we're going to do about them, that computational space. But it's also how we bring information up from the past and connect it to what's happening in the present. So when people have working memory deficits, as many people with ADHD do, or perhaps they have slower processing speed. It takes them longer to kind of what I call absorb and digest information, there will be a sense of anxiety around not being able to perform or keep up with what's going on around them. So we want to help slow things down so things can be metabolized more readily. We also want to teach options instead of reassurance. So there are a few things to think about. One, instead of I worry, can you say I wonder? Can you opt for curiosity? This is very important because we need to shift our mentality. Our brains have a negativity bias. It's what's kept us alive. And anxiety is important. It helps us scan the horizon, the environment for potential dangers, and to engage our body in a fight or flight mode. However, when people are traumatized, anxiety can also result in freeze. So what we want to do, and that's where PTSD will set in. So what we want to do with anxiety in kids is help them defeat anxiety amnesia. Anxiety is great at helping people forget times when they overcame previous obstacles or worries and met the challenge or the situation that was in front of them. So we want to start by creating a list at home that you can post on your refrigerator of times when your child may have hit a bump and did it anyway, or recalculated and did something else that was equally successful. What were the tools that they used? How were you able to assist them in recalibrating their responses? This is what helps ultimately reduce anxiety because kids can start to soothe themselves. And it also increases resilience. We want to teach kids with ADHD and anxiety and adults too to bounce back, to have us to have a real sense of believing in themselves that they can meet these challenges. Anxiety is powerful. Anxiety is manipulative. Anxiety is dramatic. It will tell you all kinds of things to convince you that you need to follow its precautions. It evolved to help us to keep us safe. We went out into the jungle. We, heard a creak creak. We saw a tiger. We went back to our cave. The next time we walk out and we hear a creak creak, we're running back to the cave, even though it's a squirrel. That's part of what anxiety does. It creates a disproportionate response to something that we're afraid of based on past information. So I hope all of this answers your question, and I'm happy to talk more specifically about how to build resilience and turn down anxiety. We're never going to eliminate anxiety. I know this because anxiety is one of my best friends, and I've tried really hard to get rid of it. It doesn't go away. What I aim for instead is reducing the intensity and the frequency. When it comes up, I see it as a signal. Something is going on in the environment that is frightening to me. Maybe it's disconcerting. I don't have confidence. And so I want to use that anxiety as an aid rather than as an impediment. Okay, so I'll take another question. Oops, hold on a second. Gotta click the screen. Karen asks, how do I help my ADHD child that started to have severe facial tics? He's bothered by them and ashamed of them. That's a great question. Karen, I would want to know if your child is taking a stimulant medication because that can happen. About 20% of kids with ADHD have tics. Medication doesn't cause the tics, but it will sort of bring up underlying tics. I think tics are very distressing to kids, and I don't know. I know all of you know that that Senator Vice President Joe Biden, who's running in our election, has a stutter, which is considered also a form of a tic. And he's talked openly about what it was like for him to grow up with that. And actually, at the Democratic National Convention, there was someone. They had a clip of a young boy who's met Vice President Biden, and he was talking. And while he was talking, he had tics, and he was stuttering simultaneously. And I was so impressed by his bravery. And this is not a political statement in any way. I'm just talking about someone who we all know on a big scale who suffered with these challenges. So when kids are ticking, it's very frightening, and it's very disturbing, and it's embarrassing because their body is doing something that they cannot control. And so I guess the thing that I would want to do, of course, is seek out medical advice. Is there a way to manage these tics that you haven't found? And I'd also want to try to do a little research with your son on who are some other famous people who've had tics. Could you write to this person? Could he get some advice from them on how they overcame them or learned to live with them? I assume that there might be maybe there's an online group for kids or maybe for parents, and I would encourage you to seek those out. Welcome, James from Pennsylvania. That's my home state. Born in Philadelphia. Thanks for joining. California. Oh, AJ, thank you. Yes, rest, rest. Pilates or other non-weight bearing. I'm trying. I'm trying. Hello, Bernadette from Ireland and Avril from Scotland. Welcome. Um, and V from North Carolina. And Alexis, you have a question. I hope you're staying safe and the air is clear where you live. Um, Hello from California, currently supporting two family members, a husband and daughter with ADHD, ADHD with a side of anxiety and depression. Glad to be here. Glad you're here too. Now we know actually that ADHD is highly genetic. It runs in families. In fact, it's the most highly transmitted mental health diagnosis we have. There's an over 50% transmission rate from a parent to a child. And if one child in a family has ADHD, there can be a 33% chance that a second child will have ADHD. And as the non-ADHD parent, it may be challenging for you, Alexis, so let us know if you have any questions. Melvi, greetings. Thanks for joining for your first time. Teresa, New Jersey. It's where I grew up. Jersey girl. And Mel, you have a question. Excellent. My 12-year-old daughter with ADHD has recently been diagnosed with ASD. And the pediatrician says she has severe sociopathic and narcissistic symptoms. Oy vey. I'm saying oy vey because these labels are not helpful. They're not helpful to you, and they're not helpful to your daughter. I'm a bit confused about this as I can't see other ASD traits. I did think she had a co-occurring issue though. So what I want to say is, diagnoses are essential for getting treatment, but I don't think that, and they're helpful for you, pointing you in the direction of information that you could obtain about your child or yourself. But sometimes, do we need to diagnose a 12-year-old with severe sociopathic and narcissistic symptoms? That seems kind of harsh. I mean, 12 years old, who isn't narcissistic? Have you ever met a 12-year-old who isn't wrapped up in themselves? I certainly haven't. So, what you want to do is take from this diagnosis some information. So, let's see, about I think it's 14%. Annie, you can post something about this too, of kids who have a primary diagnosis of ADHD also have a diagnosis of ASD. But 50% of kids who have a primary diagnosis of ASD have a diagnosis of ADHD. So these also travel together often. And what I see a lot in kids who have ADHD and ASD have to do with difficulties in social relationships. They miss cues. They have trouble making and sustaining friendships. They they may struggle with self-expression in appropriate ways. So let's focus on the skill building aspects related to this diagnosis and less on the pathologizing. Trina says, my school teachers and speech therapists say my son possibly has ADHD, diagnosed with ASD too. He definitely shows hyperactivity until he has to sit, but it's not really a problem until he has to sit and learn in a classroom. I'm worried about pursuing this further and getting him medication. I have a fair of numbing him, I guess a fair history of numbing him through meds to integrate him into the classroom. Are there good resources around the medication pros and cons? Um, I think that what you'd want to do is first of all is Annie, if you could post something about ADHD and ASD, a connection to an article and some resources on an Attitude Mag, that would be great. Um, the goal of medication isn't to numb your child. The goal of medication is to help your child have more access to the parts of themselves that they like, that are the best parts of themselves, and the parts of themselves that can help them succeed in the classroom. So there are a lot of good resources around medication, and there are pros and cons, and everybody responds to medication differently. There has been research, interestingly, that kids who have a primary diagnosis of ASD and meet some of the criteria for ADHD, but not all of it, have in this study were shown to show improvements in both their ADHD characteristics and their ASD characteristics. And this was a study uh, a few years ago, I think from the Florida International University. So we want to do your research and to help the medication sort of settle him, but not make him, feel like he's inaccessible or numbed out, as you say. Ursula, nice to have you. Thanks for joining. I tried to organize yourself all my life. I tried to listen and focus. I thought I was an utter mess. Oh, not true. You just were struggling. Uh, let's see. I was diagnosed last year, tried 3 drugs, which all gave me terrible acne. Which made me unwanted by men and employers and made me worse. I don't see huge effects. I tried some online tools, but with no help. Is there hope? Yes. So, Ursula, what I would encourage you to do is to try to find a psychotherapist who really knows about ADHD, someone who's an expert in this area or has experience in this area, who can work with you on setting up systems to manage your ADHD, but could also deal with some of the depression that I see you're experiencing here. I am sorry that the medications made things worse, but finding someone who's a knowledgeable resource for you will be helpful. You also might want to consider a coach. Pam, I believe this is recorded and you can come back to it later. Okay. Annie is posting some great resources for you guys. Jessica, my 5-year-old is very self-aware and has started saying my brain keeps telling me to do X, Y, Z, and explains that it's like screaming in his head, and once he's accomplished this task, it's like cooling sensation or relief. How can we help redirect him when he's having this type of impulsive need? So this is a great idea. This is a great question. It's not great because it sounds like he's really struggling. So what's happening is that he's internalized this voice that is putting so much pressure on him to show up, measure up, do what needs to get done. And he can't regulate that. He's very young. So I think if you could come up with an alternative statement or some kind of some sort of allying maneuver that would help him. Maybe, have him have a word to tell you, XYZ or something like that, and then you can put your arm around him and say, okay, XYZ, Time to turn down the volume. We've got this. We know what has to be done, and we're going to do it together. A lot of times you have to talk back to anxiety. Let anxiety know that you've got this. You don't need all of that extra agitation. You know what anxiety has identified that there's an issue, and you don't need all the baggage that comes with it to actually to actually act on this issue and be successful. In fact, anxiety is holding you back from doing that. Um, so Kimberly, hi. Annie, hi. Jose, thank you and welcome from Australia. Sylvia, how do I help my son who isn't interested in developing or nurturing friendships? He's 9, but really needs social interactions. He's kind, smart, funny, but he doesn't seem to understand the importance of nurturing friendships, especially now that we're even more isolated in quarantine. He's not interested in sports, loves video games. Thank you. So, what I want to say is that it takes time for kids with ADHD to make friends, and they often need a lot of modeling and support from adults in their lives to do it. And because many kids are not physically in school right now, they're losing that atmosphere. Excuse me, where teachers can pair them with other children, teachers can facilitate interactions. They don't have that, so they're going to rely on you. So, what I think is most helpful in situations like this is if you have some family friends who have a child or two who's around your son's age, to try to do some family social activities so that he's not alone having to socialize with a child. It doesn't sound like he has the confidence or the skill to do that. Um, if he's gaming, he's active with other kids sometimes, or he may be just gaming on his own. Gaming is part of a balanced, healthy social diet, but it can't be the only form of the social diet. So it might be worth trying to figure out if there is an activity for him that he might be interested in during COVID, something that would be COVID safe. I know these are really hard to find, but he's not interested in sports, but maybe he might be interested in an, a non interactive sport, maybe something like fencing or swimming or running. These are all what I call individualized team sports or martial arts. Martial arts can be a great way to be involved in something that's physical with other kids your own age. And many martial arts classes, I think, are outside right now until it gets colder in the northern hemisphere. Um, and that might be a good place to start. He doesn't need to have 7 friends. He really needs to have 2 friends. One for the person he's with, and then the person he can be with another time. And he probably will need some parental involvement in some way until those relationships are a little bit solidified. Kim, you're most welcome. Anna has a question. How do I approach ODD in my 11-year-old son? He also has ADHD and is taking medication. Anna, so glad you asked this question because I had 2 questions about this already lined up. Tyler said, I have a child with ODD, ADHD, and sporadic episodes of extreme rage and anger. I'm curious if anyone has a child with this diagnosis and what you found to be successful in treating, parenting, and supporting this child. And Mandy asked how much of ODD is just frustration from ADHD. I keep reading lots of conflicting things versus a description of a behavior, and that her son's psychiatrist won't prescribe any medication because of side effects, i.e., neuroleptics, atypical neuroleptics. So ODD, the statistical rate of ODD with ADHD is about 40%. And, the kids with ADHD can be feisty, they can be spirited, they can be strong-willed. I personally, I feel like oppositional defiant disorder is a label that is put on the kids instead of actually the situation. I think that when kids have oppositional defiant disorder, it's often also a relationship problem that the child doesn't feel met. Perhaps there's a question of fit between parent and child. There's some way in which that oppositionality is masking needs that are underneath. As I like to say, anger is the gatekeeper. And I think, a lot of kids who have ADHD and ODD are angry. Now, research has shown that when you treat ADHD with medication successfully, and you engage in therapeutic treatment, that it focuses on family dynamics as well as doing some individual work, that that ODD as a co-diagnosis will go away within about 2 years. So, when you want to approach this with your son, I think that's such a complicated question because it's about setting limits. It's about how kids are reacting. It's about whether kids have a say in the plans and programs you're creating for them. Where is it appropriate for them to have input? Where is it not appropriate? How do people talk to each other in your family? And how do you want to engender that kind of conversation? Is there a logical consequence that's linked towards saying F you to a parent? There's so many different layers. And I've worked with lots of families who have ODD and ADHD in their kids. And the question is not just like, how are we going to help this child, but how are we going to help this family system? Right? So how do you approach this with your child? I think the issue is first identifying, number one, what are the triggers? What are the situations, dynamics, activities that set off this behavior? What are the warning signs that kids are triggered and they're heading off into acting in a defiantly inappropriate way? Can you call a stop in the action, take a break and come back? I call that stop, think, act. You agree on the pause before, in a calm moment in a family meeting. I think for most families, a family meeting once a week is important, but particularly if there are power dynamics and a lot of conflict, meeting twice a week for short amounts of time might be great. And that's where you can tweak whatever programs you create. And it's also a place for kids to appropriately express some of their thoughts and feelings. Modeling for how to say things, and keeping and regulating yourself. One of the challenges of raising a child with ODD is that when their behavior can be so inappropriate and outrageous, and you're triggered, and then everybody is just, heightened. There's a general explosion, and that just makes everything worse. So we want, as adults and parents, to manage ourselves first, and then we can deal with managing our kids. So we want to predict that these explosions are going to happen instead of hoping they never do again, and to prepare for them. And how you're going to do that is unique to your family. Letty asks, my son has ADHD and is drawn towards danger, i.g., going to dangerous areas just to watch and get the adrenaline rush. How do I deal with this, please? Letta, could you explain what you mean by dangerous areas? I don't think I understand. Then I could give a better answer. Michelle, my 14-year-old, twice exceptional daughter who has ADHD and anxiety is really struggling with online learning. Yes, I hear you. She's not alone. And is not turning in her homework. She's also not performing well at all, even though she only has 3 classes right now, and 2 of them are academic. The third is art. She refuses to let us help her and refuses to let us support her in any way. We have no idea what to do as parents. We did get her a 504 plan last spring during online learning because she struggled then to help. So what I would encourage is that What your daughter wants is for you to stay out of her homework, which is fine if she's doing it and if someone else is with her around the homework. And so your job, and I think it's important to remind her of this, is her safety, her health, or well-being, and educating her. Of course, among other things, and that you don't actually want to be, the homework police, but you also notice that she's really struggling. So I will go back to the school system and perhaps ask for an IEP. Maybe she needs to be in a to get more support. And if they won't give her any, can you afford to hire a college student for an hour a day to sit with her while she does her work? Someone who she likes, perhaps someone who has ADHD and has figured out how to compensate for it. Can you maybe use if you don't have if finances are an issue, honor society students always need community service hours, and so perhaps there's a senior who's an honor society student who could assist her. The goal is getting you out of her homework. I also think that it would be useful to sit down with her and perhaps someone from the school and really create a daily schedule where she, attends class, does her homework, and then earns, free screen time or other privileges that matter to her. Mel talks about weekly anger management sessions with the school counselor. That's fantastic. I'm glad your kids are doing that and they started to see a psychologist. It's a busy life, but it's helping. So yes, I think more services are needed in your family, Anna, if you can swing it. Let's see, Pam. May we please touch on ADHD and OCD together, how they can perpetuate each other, but also how OCD relates to ADHD, such as having to write everything down to overcompensate for the ADHD. So Pam, this is really an interesting question because what we're talking about, it's a fine line. I worked with a boy. In fact, there's a quote from him in my book. What your ADHD child wishes you knew, where he basically said, I have a special routine. I do it every night. I have to put my do-rag on, then I have to, brush my teeth, then I can play on my phone, and then I can go to bed. But if I play on my phone first, it throws off my whole system. So, there's a difference between these sort of obsession compulsions that bring relief to you because you kind of it lowers your anxiety, and the obsessions and compulsions that you need to do because you need to do them, but they don't bring a reduction in your anxiety. And so for people who have anxiety and have these compulsions and they don't bring the reduction, what they're showing us is that these obsessions and compulsions are distressing to them and they don't really have OCD. For people who have OCD who are on the spectrum, their compulsions, their obsessions, their OCD behavior is like it works, right? It comforts them. So there's a difference between using strict or stringent strategies about how to organize your life to keep you on track and being inflexible about those strategies. And I think that's kind of what you're talking about. Like your when someone's having to write everything down, they are absolutely trying to cope with their anxiety about missing things. So it starts from a really functional desire to make sure you grasp everything and you hear what's going on. But the sort of the reality is that desire becomes dysfunctional. It's not helping them, it's actually holding them back because now they become so focused on making sure they've written everything down that they can't move on. And so you want to create some balance. So when are the times that you can write things down? Do you need to record them and then transcribe them in some way? What are the fears behind that the behaviors are trying to address? That's the important thing that we want to find out. So what are you compensating for with these behaviors? Kim, My family has many generations of ADHD. Just thought we were all a bit weird. Okay. My son was diagnosed with minimal brain dysfunction and was on its way out. Uh, my son was then diagnosed with bipolar after 2 years of being told he was just ADHD with rage. I say this, so if you aren't happy with the diagnosis, you should keep going, I guess is what you're trying to say. The diagnostic process is complicated and it takes time. It takes time for a psychologist or a psychiatrist, a therapist for that to get to know you, and to get to know your client and to tease out various things. The bipolar also travels frequently with ADHD, somewhere around 20%. Um, that can they can kind of walk the path. And so I think it is important that you get a good diagnosis and you feel comfortable with the person you're working with. Jessica, hi from Texas. Hi. I have triplet daughters. Wow. And two with ADHD, along with an ADHD husband. Regarding ADHD combined type, non-medicated, what techniques to help impulse control, like touching everything? So the thing about ADHD medication is that it can help with processes that are more unconscious, as well as assist us with conscious processes. So, there are 11 executive functioning skills, and some of them are cool skills, things that are more unconscious, and some of them are hot skills. So, your working memory, for example, your perseverance, your goal-oriented persistence. Um, that is not what I meant to say. What I meant to say was your sustained attention, um, your ability to be flexible and shift from one thing to another. These are things that are more unconscious. Your self-awareness and your judgment, and so medication can assist in sort of facilitating the connections between the neurons so that those symptoms that we're seeing may become less frequent. Um, im Touching everything, other kinds of impulse control, it's a tough line to walk because you don't want to be telling your child no all the time. That creates kind of negative self-image and self-esteem, and you also don't want your child to touch everything. So I would talk with them and say, look, I notice you're touching everything, and sometimes it's okay to touch things, and sometimes it's not. How would you like me to tell you when it's one of those times that it's not okay? Because I don't want you to feel bad about your curiosity. Reframe the impulse control as curiosity. And sometimes you need to keep your hands and your body to yourself. So that might be just the redirection, keep hands to yourself, please, or body to yourself, or this isn't a time for touching. So to just continue to redirect them. It's exhausting, I imagine, but I think eventually this will subside. Over time, what happens is that people who have kids who are diagnosed, many kids who are diagnosed with the hyperactive, impulsive type of ADHD, over time it transitions as they mature to inattentive ADHD or the combined type. Annie, my 11-year-old has ADHD and is doing well on Ritalin. Well, that's great. I am concerned about anxiety. What are the signs? She is very fearful of not having a friend or being alone without a connection with a friend or device. She still needs me to fall asleep at night and is worried whenever I leave the room. So I think being concerned about anxiety makes sense. It sounds like she has some anxiety. And that's something that I'd want you to talk about with her prescriber. And you might want to consider finding her a counselor, a therapist, to work on the anxiety and the ADHD. Because, as I said, a lot of kids with ADHD walk around with a certain kind of hypervigilance. And some of that is biologically based, and some of that is experientially based. If you're a child with ADHD, you get a lot of feedback about, what you could do better or differently. And that kind of leads you to becoming more vigilant about what you're doing that isn't the desired behavior or action. It also sounds like she doesn't feel confident in being by herself. Maybe she doesn't know what to do. She's afraid of the dark, and it could be transitional. So what I would talk with her about are, some ways that she could start to manage her own anxiety. And there's a lot of really great resources, books for kids, some mindfulness could be useful, particularly before bed. How to relax, how to do a body scan. These are all useful tools for kids with ADHD and anxiety. And let's see. Oh, it's 4:45. I'll take one or two more questions. Missy says, I have a 13-year-old stepdaughter with severe ADHD. I swear she was misdiagnosed. She literally acts like a toddler. And as an up and coming stepmom, I'm freaking out. I don't know how to cope with her. So I'm not sure how to help you, Missy. We do know that kids with ADHD can be as much as 3 years behind in their maturity. There's an environmental component to to behaviors of all children, and particularly those with ADHD. And I think the most important thing in your situation is that you and your soon-to-be partner are on the same team. You're on the same page, and you work together, and you with whatever interventions, and you give consistent messages. Ursula, you're most welcome. And Christina, hello. I have a 16-year-old daughter, and everyone says it's a teenage thing. She's on 15 milligrams of Daytrana, which is not lasting 5 hours. Recommendations, please, for ADHD meds that would be equivalent. So I can't really make that recommendation online, of course. I would encourage you to talk to her prescriber. The patch should last longer than 5 hours, so that's really a question for a physician. Vero, great. Vero, medication was making my son angry, and we fixed it by reducing the dose, and the change was noticeable. I think that's a really important point, Vero, because medication can have different effects on different kids. I had a client who took Focalin, and it really made him very agitated, and then he switched to Strattera, and he's much less agitated. So everybody's brains are different, and I think it's worth honoring what you're seeing and talking about that with your provider. And here I'm going to end with this question because it's such an important one, and I think it will encompass a few other questions. So Casey says no, not Casey. Sorry. And Annalise says, is extreme argumentativeness in my older teen a symptom of ODD or just plain teenage stuff? Said teenage is ADD inattentive. Said teen is ADD inattentive. And then Julie says, 17-year-old with ASD thinks she has ADHD, but I do not. I guess health insurance isn't buying it. No evidence, but plenty of evidence. What do I? Okay, not sure I understand that question. So, I want to say something about, is it adolescence? Is it ADHD? Everyone often asks me, well, what part of this is adolescence and what part of this is ADHD? And my answer to you is yes, it's both. And they're intertwined like this. We can't tease out necessarily this behavior is related to ADHD and this is only related to adolescence. They're fundamentally and intimately entwined. And so a behavior is behavior. So rather than trying to figure out which part is ADHD and which part is adolescence, I would encourage you just to deal with the behavior itself and what's underlying the behavior. That's the important thing, okay? Well, you'll find out later which was which when they mature and some if some of those behaviors are still there when they're in their 20s, right? So let's just try to deal with what's happening and meet your kids where they are. That's the most important thing for raising kids with ADHD or kids who are on the spectrum or any kids at all, is meeting them where they are, not where you think they should be, and working with what you're dealing with in the moment and not comparing them to neurotypical kids. And this is true for yourself too. Accept yourself where you are. Whether you're an adult living with ADHD or you're a parent raising a child with ADHD or any other co-occurring condition, you and your child are doing the best you can given the resources you have access to in any given moment. And I think it's important when to remember that when kids are acting out, they are showing us that they cannot manage the demands of a situation. They're overwhelmed, and that acting out is showing us they're overwhelmed. So we're going to come back to ADHD and co-occurring conditions next week as well. I'll probably focus a little more on depression as well as anxiety because it's always a favorite. But I'm happy to talk about anything that you want to ask me about. In the meantime, I hope you have a beautiful weekend. I want to encourage you